Hi, my name's Jack. I'm going to be taking care of you today. I'll be your nurse. Could you just tell me your name and date of birth, please?
Hi, Jack. I'm Sarah Clementine, February. Sorry, I don't give my real name. I changed my mind. Start over.
What was the date?
February 12th, 1999.
All right, awesome. Clementine checks out. So, it's nice to meet you. I'm just going to have you get started. This is some general survey information. Could you fill this out for me?
Yep.
Let me just get you a pen. There we go. Here you are. While you do that, I'm just going to wash my hands, okay?
Okay.
All right, all set with the information?
All done.
Thank you very much, Sarah. I appreciate it. So, Sarah, to get started, we're going to start with vital signs. And on the general survey, it filled out basic biographical information. I'm also going to take note that the client is fully conscious. I saw her able to ambulate earlier in the hallway, and she is cooperative. So, Sarah, I'm going to start with your vital signs. So could you just give me your arm? We're going to start by taking the radial pulse. One thing to know, as I take the radial pulse, I'm also going to obtain consent. Is it all right if I touch you from the patient? Awesome. Thank you, Sarah. Is as we're taking the radial pulse, after the first 30 seconds, I'm going to multiply by 2 to get the heart rate. And in order to get the respiration rate, I'm actually just going to leave my fingers here on the radial pulse, and I'm going to watch Sarah's chest rise and fall. I'm going to take note of how many breaths she has in the next 30 seconds. And then again, we'll multiply that by 2 to get the respiration rate. All right. So pulse is going to be 64. Now I'm watching chest rise and fall to get the respiration rate. And the respiration rate is at 14 breaths per minute. All right. So Sarah, next I'm just going to be taking your blood pressure. Do you have a preference for which arm?
My right arm's good.
Okay. Just so you know, you're going to feel a little bit of pressure, but you shouldn't feel any pain. Let me know if you do. Now, when I'm first starting with taking the blood pressure, first thing I'm going to do is I'm actually just going to inflate the cuff and feel for the brachial pulse. And when I no longer feel the brachial pulse, that's how much I know I have to inflate to. I'm going to go 30 past that. All right. So I'm going to go right about to 170 for Sarah here. No pain or anything, Sarah?
Nope.
Sorry, I know it's a little bit uncomfortable. All right. Blood pressure is going to be 124/80. Not too bad. Next, I'm just going to take Sarah's temperature with a thermometer. So, Sarah, can you just put this under your tongue for me? Awesome. Hold that there. While she does that, I'm going to attach the pulse oximeter. This is just going to be taking her O2 saturation, so I'm going to attach this to her index finger here. Beautiful. Awesome work. Now, while she's doing that, I'm just going to take down her information here. Beautiful, Sarah. All right, let's see. What's that temperature? All right, 98.3. Perfect. Put the thermometer down. Now, as I continue my assessment, I'm going to be taking note of Sarah's skin. I'm going to be looking for any type of abnormal growths, lesions, any changes in color. I'm just going to check with Sarah, see if something's a birthmark, or if it's changed, or if it appeared recently. All right. Now we're going to start top to bottom. We're going to start with the head and face for Sarah. So Sarah, is it all right? I'm just going to be touching the back of your head. I'm just going to be feeling for any swelling or edema, anything out of the usual, okay?
Mm-hmm.
All right, bring my head forward a little bit. Awesome. So here, I'm going to be taking a look at the lymph nodes near the occipital lobe. All right. Awesome. Also palpate the sinuses right now. Sinuses seem normal. All right. No swelling in the lymph nodes, no abnormal growths or anything. Bring the head back up for me. Nothing seems unusual. No redness either. Her face is symmetrical, just going to take note of that. There's no involuntary movements or masses. So let's see, where is my... Perfect. So Sarah, I'm just going to be using this. I'm just going to be testing your sense of feeling, okay? Sense of touch. So I'm going to have you close your eyes. Using the cotton swab here. Am I touching you?
No.
Okay. I want you to tell me where I'm touching you. Alright, when I am. Am I touching you now?
No.
How about now?
Yeah, on my right cheek.
Okay. Now?
On my left cheek.
Awesome. Normal sensation for Sarah there. Alright, so now we're going to be palpating the jaw. So open your jaw. Awesome. Close it. Good. Good jaw strength by Sarah. So we're going to be inspecting the nose. Just grabbing my flashlight here. So I'm going to note the nose is symmetrical. I don't see any nasal defects, no deviated septum or anything. But now I'm just going to take a closer look with my flashlight here. Big nostrils for me. Oh, look at that. Awesome job, Sarah. Okay. Now we're going to be doing the mouth and throat. I'm going to keep this here. I'm just going to be looking for any abnormalities in the gum, tonsils, excuse me, or in the tongue as well as the pharynx. So Sarah, open wide for me. Stick your tongue out. I'm also taking note for any odor. Can you say ah? Come on, real ah. Is that all you got? That's, come on. There we go. Awesome work. Now I'm going to be using a popsicle stick to test for the gag reflex. So I don't have a popsicle stick, so we're just going to pretend for right now. Open wide. All right. Again, there was no odor. So I'm going to palpate the neck on either side, checking for symmetry. I'm not going to take the carotid pulse on both sides at the same time, as that could cut off circulation. Something important to take note of. But right now I'm just checking the lymph nodes. Any swelling, edema. Alright, I'm going to just get the carotid pulse now. Strong on this side. Good. Also going to note that there is no jugular vein distension. Just getting my stethoscope. I'm going to start by using the diaphragm, then I'm going to be using the bell. I'm taking note of anything abnormal. Okay. Switching over to this side. Good. We're going to be checking both carotid arteries. Awesome, Sarah. Next, we're just going to be checking the strength of the sternocleidomastoid. So I'm going to put my hand on the side of your face, Sarah. I just want you to turn into it. I'm just going to be testing your strength, so I'm going to give you a little bit of resistance here. All the way, you got it. Oh, really strong. Awesome. This side. Great. All right. Strong bilaterally, normal pulse bilaterally as well. No bruits or anything detected upon auscultation. I also didn't note any edema or swelling in the neck. So I'm going to test the strength of the trapezius muscles now. So Sarah, I'm going to have you sit up. Face the camera for me. There you go. Awesome work. Alright. So I'm going to press down. I'm going to have you lift your shoulders up, shrug up. Good. Strong bilaterally there. From here, we're going to start with the eyes, so you can remain sitting here. So we're going to start with the Snellen chart. We don't actually have a Snellen chart, so I'm just going to have Sarah. We're going to use one eye at a time, and she is going to read the top of the imaginary Snellen chart.
EQR.
All right. Let's go a few rows down.
CMTW.
All right, switch eyes. What's the fourth row say?
SCYWM.
Great job, 20/20 vision. So I'm going to be inspecting the eyes. Open wide. There you go. Pupils appear normal. Iris looks healthy. So I was going to be testing her reflex to light, see how her pupils react. Good. Normal dilation on the right side for Sarah. I'm going to come across from the side here. Alright. Dilation. Symmetrical both sides. Now I'm going to have Sarah follow. We're testing for convergence first. So I want you to just look at my little flashlight here. Good. Next, I want you to follow it. Don't turn your head. So we're going to go side. Good. Great job, Sarah. Just going to be looking at the cornea and the conjunctiva. Hold this down. Looks healthy. Good blood supply. No excessive redness or anything along those lines. Next, we're going to be switching over to the ear, so I'm going to start with the whisper test, Sarah. So, I'm just going to explain it to you. I'm going to have you cover one ear, okay? And I'm going to sit behind you, and I'm going to give you a sequence of letters, all right? And I want you to repeat those back to me, and then I'll have you switch sides to the other ear, okay? All right. So, we'll start by assessing the right ear, so I'll have you cover your left ear.
CDWR.
All right. Switch sides.
QEMV.
Awesome. Great work, Sarah. So that's normal bilaterally again. No deficits in hearing. All right. So I'm just going to be inspecting the ear. Both sides. Good. Next, we're going to palpate the pinna. No tenderness or anything. I don't feel any abnormal swelling.
Mm-mm.
Let me know. No pain?
Nope.
Awesome work. I'm just going to take down those notes. I palpated the pinna and tragus there. And if I had an otoscope, the one thing I would do is I would also look and I'd be able to see the tympanic membrane. So pretend there. Good. Next, we're going to be moving on to our assessment of the heart. So we're going to go for the point of maximal impulse. So we're going to have to find the fifth intercostal space on Sarah here. So I'm going to have you lay on your back, Sarah. Back where we were before. All right. We're going to start up at the clavicle. Good. 1, 2. And we're just going to count down 5 on the intercostals. All right. I'm just going to be assessing here. All right, normal pulse. I don't hear anything abnormal. I use both the bell and the diaphragm there. She's not using her accessory muscles too much in order to assist her. So next from here, we'll be auscultating 4 different areas. We'll start with the aortic, and then we'll go to the pulmonary area. So for the aorta, I'm going to find the second intercostal space on the right side. 2. Now we should be able to hear that here. Taking note of any bruits or any abnormal heart sounds in case of a heart murmur or something along those lines. Nothing abnormal. Now we're going to go pulmonary. It's going to be second intercostal on the opposite side. Good. Now we're going to be assessing the bi and the tricuspid valves. So fifth intercostal space. Good. No bruits or anything abnormal there. S1 was heard the loudest at the heart apex. And S2 was heard the loudest at the aortic or the pulmonary and the pulmonary valve. The apical rate is normal with normal rhythm. Just taking that down here. Cool. So Sarah, I'm just going to have you sit up now. We're going to be assessing the lungs. So I'm actually have you turn it so your back is facing towards me. Awesome. Thank you. You all right if I move your hair out of the way?
Mm-hmm.
All right. Thank you. So first, we're looking for symmetry as usual. Nothing appears abnormal here. So we'll start with the upper lobe of the lungs. We're going to be assessing. We're listening for any wheezing, crackling, anything like that. So we'll start with the upper left lobe. Nice, good breaths. Nothing abnormal there. Good. Now we'll assess the left. Just gonna lift up your shirt. Is that all right?
Mm-hmm.
Now there's only 2 lobes of the lungs on the left side, and there is 3 on the right side. Or you're gonna be assessing the lower left lobe. Awesome. No crackling. Now we'll come back here to the middle lobe on the right side. Good. And now the lower right lobe. Awesome. No crackling or wheezing. Sarah, I'm just going to be spinning around now. I'm going to lay down. Good. From here, we're just going to be assessing the lungs again from the front. Start with the upper lobes. Good, normal there. I'm going to come across Sarah's side here and listen here for the lungs. Same on the opposite side. Awesome, nothing abnormal there. Great job, Sarah. Thank you for being so cooperative today. Fremitus is normal. Now I'm going to have you sit back up again. Turn around. I'm going to palpate the back of your lungs here. Here, your back. Let me know if you have any tenderness or pain. I'm looking for any swelling, anything abnormal. Again, always, as I'm doing these different examinations of the body, I'm taking note of the skin. What's the color? Is there anything abnormal growth or anything along those lines? Any lesions? Any tenderness?
Nope.
Okay. Awesome. Thank you, Sarah. You can stay there. I'm going to go to percussion now. You alright if I lift my shirt up?
Mm-hmm.
Just going to be percussing. Awesome. Great job, Sarah. Now I'm going to have you lay back down. We're going to do an abdominal assessment next. Just going to fill in the information for her respiratory assessment. Could you lift your shirt up for me just a little bit? Is that okay?
Mm-hmm.
First thing, take note of any lesions, scarring. First things first, also check the skin. Next, we're going to auscultate the different quadrants of the abdomen. 4 quadrants here. All right. From here, I'm going to be percussing the different quadrants. Nothing abnormal there. I'm also noting there's no distension or anything going on with the abdomen so far as I can tell. I'm going to come on either side of the belly button now, and I'm going to be feeling for the aortic pulse. All right. Now that I have that, I'm going to auscultate. Starting my auscultation with the diaphragm, now I'm going to go to the bell, see if I can hear any bruits or anything along those lines. Good, sounds normal. Next, I'm just going to palpate. Let's feel for any edema, tenderness. Okay, any pain here, Sarah?
Nope.
Here?
Nope.
No?
Nope.
All right, thank you very much, Sarah. I'm just going to put down this information. And now we're going to be moving on to the upper extremities. So Sarah, could you sit up for me? Face me. Great job. All right, symmetry first, arm straight out. Good. Appears normal, no asymmetries. We'll start with the fingernails. I'm just going to be testing capillary refill. Good. Blood immediately returned within a second. Normal capillary refill. You can bring your arms down for me. So here, we're going to be looking at the shoulders. You mind if I just touch your shoulders? Okay. No pain or tenderness along here. I don't feel any swelling. Right? No pain or tenderness?
Nope.
Awesome. Thank you very much, Sarah. Now we're going to go to range of motion. So I'm going to start with shoulder flexion. So can you come all the way up here for me, Sarah? Can you get 180 degrees? Yes, you can. All right, other side. Good. Now let's go extension. Good. She can actually hyperextend. Can you hyperextend on this side as well? Awesome. She has extra range of motion there. Can you flex at the elbow? Good. And full extension as well. Nice. Come out like this. Good. Alright, now I'm going to just be assessing the wrists. Rotate them for me. Other way. Flex. Extend. Awesome. Appears normal upon physical assessment and range of motion tests. Full range of motion. I'm also just going to be feeling skin temperature. Appears normal. Alright, really good job, Sarah. Thank you. And now I'm going to be palpating the radial and the brachial pulse. Did this earlier, so I'm just going to check briefly, make sure they're present. Good. Awesome. Take that down, and we just have one more assessment. So I'm just going to be testing your grip strength. So can you squeeze my fingers? Good. Hard as you can. Come on, you're stronger than that. All right, good. Strong both sides bilaterally. From here, we're going to be moving on to the lower extremities. I'm just going to fill in this information. We're going to, again, start with capillary refill with the toenails. So I'm going to have you lift your leg up for me. Just going to squeeze here. Good. Return in less than a second. Awesome. Now, if I had a reflex hammer, I would test her knee reflex by striking right about here. Boom. Yeah, there we go. I'm also just going to inspect again. I do not see any varicose veins, anything abnormal. No swelling or edema in the ankles or in the feet. Okay. All right. I'll palpate the popliteal artery here on both sides. Good. Now we'll go tibial. And the dorsal pedis. Dorsal pedal pulse. Good, normal, +2 both sides. And I would do the femoral pulse, but I'm not going to do that right now. Just grabbing a sip of water for a second. Next, we're going to be assessing range of motion. Can you extend? Awesome. Now I'm going to have you lay down. Testing the hips range of motion here. Ready? Just come up, be loose. Bring the knee up to your chest all the way. Awesome. Good. On this side. Great work. Good job. Now I'm going to be testing your strength. I'm going to have you lay down this way. Actually, you can do it here. That's fine. Bring your legs up for me. Good. Good strength. And back. Nice. Now we're going to go with the feet. I'm going to have you flex your toes up. Good. Really strong dorsiflexion. Now 6 plantar flexion. Down. Awesome strength. Strength is normal bilaterally. Okay, I'm going to have you lay back down on your back now, Sarah. Also, don't notice any changes in the skin coloration, and her temperature appears normal. So from here, we're going to do the Babinski test. See if her Babinski reflex is present. Good. Now we're going to go sharp, dull. Close your eyes for me, Sarah. Is this sharp or dull?
Dull.
Okay. Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Right, normal sensation in the lower extremities. And the Babinski reflex is normal. I'm going to take this down, and now we can move on to the spine. Sarah, I'm going to have you sit up straight for me. So we're going to be assessing the spine nice and straight. All right, no kyphosis or scoliosis. I'm going to palpate the spine here. Any tenderness?
Nope.
Just let me know. I'm going to come all the way down here. I'm just taking note of any swelling again. Good. Awesome. Now let's see your range of motion here with your spine. You come to the side. Other side. Good. Try not to move your whole body. Come to the side again.
It's wiggly.
Good. And now forward. And back. Awesome. Now we're going to be looking at your head, so I'll have you turn and face the camera just for this section. Yeah. So, side to side. Have you come here. Up, superior, and down to your chest. Awesome. Normal range of motion there. I'm going to have you stand up, Sarah, and we're going to do a Romberg's test. Just going to fill in this information in our chart. Okay, Sarah, for the Romberg's test, can you put your feet really close together for me? All right, awesome. Close your eyes, and we're just going to be assessing your balance here. Usually it's a little bit harder to balance with your eyes closed. All right, great balance there. You can sit back down for me. You passed. Flying colors. All right, putting this down in our chart. Last thing we're going to be assessing here is we're going to be assessing rapid alternating movements. So I'm going to have Sarah come here with her fingers. Do this both sides. All right. Now just one. Next finger. Next finger. Good. Now go through all again. Now I'm going to have you pat palm and back of your hand to your thigh. Rapid, 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 rapid. All right. And she passes the rapid alternating test. I'm going to put that in her chart. And she is all set. All right, Sarah, thank you so much for helping me out today.
No problem.
Do you need anything or do you have any questions for me before we wrap up?
Nope.
All right. Doctor should be in to see you in a minute.